It is my pleasure to introduce Dr. Jyothi Unni for the next session, Perineum Evidence to Practice. Dr. Jyothi is an astute clinician and a thorough academician. She has a passion for training doctors, nurses, midwives. She has been at the helm of the scientific program of this conference. Welcome, Dr. Jyothi.
Welcome to the second day of NLBC. Thank you for attending this session on perineal injuries. Before we begin, I have a couple of poll questions for you. The first one is the risk of perineal injuries affected by birthing positions? Do answer yes or no. We will have the results for you by the end of the session. So we'll show you the results just before the Q&A. And now for the second question. What is the episiotomy rate in nulliparous women in your institution? Is it less than 20%, 20 to 40%, 40 to 60%, or more than 60%? I hope you have answered those poll questions. As we're all aware, many women do have some form of perineal trauma during childbirth, and this leads to either postpartum discomfort or even pain, but this usually resolves quite quickly. Unfortunately, there are some women who have lifelong pain, dyspareunia, or even incontinence. And this then has a significant impact on not just their physical health, but also on their mental, sexual, and emotional well-being. So much so, some groups have even advocated performing elective cesarean sections to prevent this long-term impact on the pelvic floor of severe perineal trauma. Over the last decade, there has been a lot of research done on various ways and means of reducing perineal injuries, and if they do occur, the management strategies. Let us now listen to these three eloquent speakers tell us how to translate all that evidence into practice. Our first speaker, Dr. Rachel Reed, has worked in midwifery units both in the UK and in Australia. She is someone who really believes in physiological childbirth. She has published widely, and she is a writer and a presenter, and also the author of the Midwife Thinking blog. Over to you, Rachel.